love to do work for community. So here in the United States, I'm also working. I work for Red Cross, and I'm an ambassador for another organization called Be the Match. So yeah.
Wow, that's so nice to hear. So why did you decide to come to the US right after your graduation?
So actually, my family used to live in the US for last 7 years. So I came here with them as a green card holder. So yeah, I'm an immigrant here. I'm
All,
permanently living in the United States now.
all right, okay. So you graduated in 2020, and since last 3 years, you've been practicing as clinical assistant. Can you tell me more about your experiences over the last 3 years?
Yeah. So first, I as I came into the time of COVID-19, so that time was really tough, and I became mother like after 4 months when I came to the United States. So after my baby was born, first I felt very much that I need to serve the community in the time of emergency as a doctor. So, first of all, I started as a pharmacy technician at Rite Aid Pharmacy. I worked there for 7, 8 months. Then I started working as a clinical assistant in the primary care clinic where I'm currently working. Yeah, and apart from this, I also did some externship, observership at different hospitals.
Okay. So you mentioned you are a mother of a toddler now. I mean, your child will be a toddler. So how is it managing your studies and your work and a kid? How, tell me about that.
Yeah, sure. My daughter is 3 years old and she's going to preschool now. And I have a very supportive family. My parents are living with me. I have two other sisters, and actually, my daughter is growing with everyone. Everyone is very supportive towards my education, and that's why I could manage everything. And I think I have a very good time management skill. So I was able to manage everything: my job, my USMLE exams, and my daughter. I think raising my daughter was not a problem for me because of my very good family support.
That's very nice to hear again. All right. So you mentioned so much about your experience and your community services. Tell me something outside your career and your community. What do you like to do usually?
um Maybe I would like to mention that I really love to work with animals. Like, I don't have pet in our house, but I love to work with the street animals. So in our locally, we have 7, 8 cat, and I feed them every day. So I think that's one that I really love to do.
All right. Okay. So residency is going to be hard. The working hours are going to be much. And so how do you have any way to cope up your stress?
So, yes, I think residency will be hard. And first of all, I am preparing for it. Now, where I work, we have to work from 8 a.m. to almost 7 p.m. So it's 11-hour works. And I think I will be able to maintain this long shift, but still there will be some stress. Um, I have a very good family, I said you, right? So I think spending time with family gives me lots of positive energy. Another thing, I really love to do cooking. So when I'm stressed, I think if I make a new dish or something like that, something new, innovative, I that helps me to relieve my stress.
Okay. Uh, sure. So why do you want to come to our program specifically?
So first of all, your program is a community program. I am myself is a community person. I love to do community work. So I think being involved in your program, I will have the opportunity to work for community. As your program is community program, plus your program is very well structured to educate the residents. I want to grow as a compassionate, very educative physician. So I think your goal and my goal align with each other for the community service and the educational purpose. And I love some aspect of your program, like you have ample of research opportunity. I really love it, and the geographical location. I have my family here, so definitely that's a very positive point for me. I will have the good family support throughout my residency period. So all of this made me really interested about your program.
All right. So why should we choose you? Like 200 applicants are applying today. Why? What makes you special?
So let me start from my internship period. When I was doing my internship, now I'm working. I found that everywhere I can create a sense of reliability in my mentors or my supervisors. They really loves to work with me and they believe me for lots of responsible tasks. So I am sure that if I get the chance, I will be a very reliable resident. I am from a diverse background and I have work experience with people all around the world and very challenging and changing situations. So I think I'll bring diversity in your program and I will be able to cope up with any tough situation. Apart from this, I speak multiple language, so I think I'll be a good communicator for uh, the diverse patient population. So yeah, I think all of this makes me a unique candidate.
Okay, good. So you mentioned that you speak multiple languages. Can you tell me the languages you speak? Name.
So my native language is Bengali. I speak Bengali, and I know you have a very good amount of Bengali patient population. I can communicate in Hindi and Urdu too, and I know a little bit of Nepali too. So yeah,
All right. So, okay, so your profile looks good, and I'm confident that you will be able to work. But what we are looking in our program is somebody who can work in a team. So, can you tell me some past experience, any experience from your past, which shows that you have a teamwork, uh, this characteristic also?
definitely. So I used to live in I first of all I grew up in a very extended family. We used to live 13 cousins together. So from here, I think my teamwork was built. Then I used to live in the hostel. So at that time, I had to deal with girls from all around Bangladesh. Then I did my internship. In the internship, we used to be 150 intern, and in the sub group, we used to be 30. And I can say you that I was very good at team in my internship too. I had a very good relationship with my teammates. Now I am working as in a primary care office. Here we are all another team, and I think yeah, I'm a very good team member, and sometimes I can be the team leader too.
Okay.
I have lots of work experience being in the team.
Okay, that's good. So you said you can be a team leader as well. Can you define what a team leader is and what should be the characteristics in a team leader?
Definitely. So I think the first of all, a team leader should be very non-judgmental. A team leader should be very positive towards the team member. A team leader should have the mentoring capability. I do mentorship for Usmle students. I do mentorship for research. So I think I have that. And another thing, a team member should be very open to feedback. So when I work as a team leader, I always try to get feedback from my teammates where I should improve and where I can work on that. I think that helps me to improve a lot.
All right, okay. So one behavioral question I'll ask. Can you tell me a time when your integrity as a doctor was tested?
Um,
Have you had such experience?
so yes, when I was doing my internship, I found one day it's actually uh, in the evening time. One of the my colleague came that and he said that one of a VIP patient came with his wife. His wife is having some asthma issue, so we have to admit the patient. But we were fully booked. We didn't have any empty bed at that time, so we have to discharge one of our patients. Then I asked him whom I can discharge. We have already discharged all the patient who are stable in the morning. I think we cannot discharge any more patient at this moment. So he said that we have to discharge because we have to make the VIP happy. I'm saying, no, I cannot do that. Maybe I can talk to the person. So I went to the ER. I talked to the person. He was very nice. And I said that we don't have any vacancy now. So actually, I won't be able to admit your wife now. But in the emergency, we can do the oxygenation and the salbutamol to make her comfortable. So We did our best to make the woman comfortable, and then we just referred her to another hospital. But at that time, I realized that sometimes we just pre-occlude things that we have to serve the a person who are superior, but that's not the reality. They are human too, and they understands the reality. So when I approached the person, he was very nice. He was agreed with me, and they were happily transferred from our hospital to the another hospital. So I think that's another time my integrity was tested, and I was able to manage it.
Okay, good. So tell me a time when a patient made you change your decision.
Um, so yes, uh, actually, it happens many times because sometimes patients comes with symptoms and we try to manage the patient according to the protocol. Then patient says something that we have to change our decision. So while I was doing my internship, one night a patient came and he had a very high blood glucose level over 300, and I said him that we need to start insulin right now, and he said that no, I cannot do insulin because I am afraid of needle. So I first of all I tried to make him understand, but he said that he cannot do that. He won't be able to take injections. So then I had to treat him with the oral medication. So I think that's the time with sometimes patient autonomy or patients thinking, patient choice make us to change our decision.
Yeah, all right. One last question for you. Can you give me an example of your one good role model and one bad role model?
So my good model, if I tell you from the historic character, maybe I would say about Mother Teresa. I really idolize her. The things I like her about her most is that she worked for a different community. She wasn't white woman, but she served all her life in India. So that's really that's really an amazing thing for me because I think she was very open to help anyone. She served the leprosy patient at hard time. It was considered a very contagious disease, but she didn't care about herself and she served them. So I really idolize her, and I also want to dedicate my life to the service of community. And yeah, so least uh, idol person. That's really tough. Maybe I would say about any historic character like Hitler. He killed so many innocent people, and I really felt it bad because I think everybody has the equal right to live in this earth. No human based on their race or religion should be the victim of some genocide. So definitely, yeah.
Okay, that was a very good interview. You answered, it looked very natural. You were answering, you answered every question you thought, gave it a thought, and then you answered. And yeah, all of your answers were nice. I actually have all good feedback only. If anyone wants to give a bad negative feedback so that Miss Ariba can improve, please go ahead. I don't have any bad negative feedback for you.
No, everybody should.
I actually, you did wonderful. So yeah, I do not have any negative thing to say. You were perfect. If you just go like this, yeah, I'll be impressed. It looked very natural. That's what we are seeing, and you can relate to the director or the program. Looks like you're a good kid. So yeah, if anyone wants to go ahead and give any feedback, we have
Is there
11
anyone else?
candidates.
Oh, there another 10 participants. I never realized that. I was thinking that I'm talking to you.
No, people were listening to you.
Yeah. Okay. So
Anyone wants to go ahead and give a feedback to Dr.
please,
Ariba?
please,
Abira, I'm sorry, I'm pronouncing your name wrong.
no, no problem.
I liked it. It looked very natural, and yeah, somebody said you are natural and you did very great. So
Thank you. But I would like to have some negative feedback too.
No, sorry, can you hear me? I'm not sure if my audio is working.
Yeah, I can hear you.
Oh, good, good. No, just to be honest, pretty much the same. What's already been said. I think it looked very natural, and also there were some questions that you clearly did anticipate and you were not prepared for. But you paused, you took time to think about it, and that was very genuine as well. And you didn't just rush right away, So no, that was really good. Um, uh, I'm trying to think of something negative that you could improve on, but I honestly can't think of anything. Yeah, sorry.
So, do you think that I really talk too fast? Because I got the feedback many times that I need to slow down a little bit because I took
So
too
I
fast.
haven't heard you before, but today it looked normal. Like it didn't look
Normal?
fast or not slow. I do have a feedback. You mentioned community service a lot. If you can just mention what type of community service you want to serve patients, you want to do street medicine. If you can just specify that. I'm not sure if that will make a difference, but if you can just specify what community service you are looking for in the future.
Oh, okay, yeah. So, um, I
You
think maybe
mentioned
I would say something like that. I would like to run a community clinic, and that's why I have chosen internal medicine and choose a doc. I choose to be a doctor because I think that every profession has important roles in the society. But as a doctor, we can just serve people with our knowledge. So, if someone is having some fungal infection, we just can see and prescribe some medication. I think that's another charm of our profession that we can serve people immediately just with our knowledge.
yeah.
So, after completing my residency, maybe I would like to open a community clinic where I can help people with something like that. I can check the blood pressure, and if the patient is hypertensive, I can start a medication. So yeah, I would like to open a community clinic.
Yeah, perfect. Rest, everything is good. You
Thank
want
you.
some questions to be specifically asked? Do you want to practice on some questions? I thought I covered almost everything. If you want specific questions to be asked, then you can just let me know. I can ask those also.
Okay.
When is your
So
interview plan?
my next interview will be on 8 November.
All right.
2 days.
So,
Yeah, I have to. Thank you. Thank you, everybody. Okay. I can take your mock now, right, Erika?
yeah, sure. I won't be switching on my camera, so please forgive me for that.
No, no, that's good. But if you are okay to speak if you think that you have practiced enough in front of camera, then it's okay. But in the real interview, we have to I was very bad at eye contact. I
So
used to
right now it looked like you're looking at me. So were you looking at the camera or the screen?
yeah. I'm joining from my phone, so yeah. Right now, I'm looking at the camera. So
Okay.
mm,
All right. I cannot switch on my camera today, but tomorrow I'll try that.
yeah, that's okay. That's absolutely fine. Okay, okay, Dr. Jacob. Good morning. How are you?
Good morning, Dr. Chaudhary. I'm doing good. How are you?
I'm doing fine. Yeah. So, how is your interview season going?
It's
Are you
going
feeling
good.
nervous?
Yeah, I was a little anxious in the starting, but yeah, I'm much more confident now, and it's going good. Yeah, thank you for asking.
Okay. So, I have read your CV. It's amazing. But can you tell me a little bit about yourself in your words?
Definitely. So my full name is Erica Jacob, and I'm coming from India. My journey in medicine has been driven by a shared dream. Firstly, my parents, their desire to have a doctor in the family, because both of them come from a family of non-doctors. And secondly, my own growing passion in this field. I took my first step towards fulfilling this dream when I pursued my medical education at Christian Medical College, Vellore. It's one of the top institutions in India, and that experience changed my life, both academically and personally. Throughout medical school, I was not just a student, I was taking part in volunteer services and community research. Additionally, I discovered myself outside classroom by engaging in multiple extracurricular activities from dance competition to hiking and basketball. Um, After completion of medical school, I have worked in India for almost 3 years in diverse healthcare setups, which helped me improve my skills and my knowledge. And it also made me more adaptable and culturally sensitive. I'm really excited to be here, and I must say that I'm impressed by. I did some research about your program, and I'm impressed by the emphasis on academics, the structured teaching, and supervision your program provides to the residents. So I'm looking forward to discuss how I can contribute to your team. So thank you again for having me.
Good. Yeah, very nice to hear that. You said that you like our research project. So which research you like? Which research made you like exceptionally interested in our program?
Sorry, I mentioned I researched your program, and I like your emphasis on academics, the structured
Okay.
teaching, etc.
So,
So
which part of the academic you liked most?
So firstly, the patient population is very diverse in your hospital, which definitely will give me more chances to adapt to different pathologies and improve my skills and my knowledge. Secondly, your website, as it mentions, that it has a unique perspective of supervision, faculty supervision, plus resident responsibility. So I'm looking for a place to get trained, and I want to get trained under supervision so that I don't commit mistakes, and yeah, I correct whatever mistakes I do because somebody will be supervising me. Thirdly, I really like you mentioned in your website that you have a dedicated advisor for each resident. Um, which is very important according to me during this 3 years of training.
Yeah, that's true. We provide so much emphasis on the academics. We really want to grow as a very good physician. So, what do you think? What personality trait will help you to grow as a good physician?
To be a good physician, I believe every doctor is a teacher and a student. So a doctor should always be curious to learn more. That is one of the uh, one to that is one of the trait to be always clinically competent. And so yes, that is one trait. Second, a doctor should also be honest because I believe the journey ahead is challenging, and we are likely to make mistakes. So honesty is something which is very important. And the most important thing according to me is empathy, because I believe even artificial intelligence and medicines can cure disease, but only a doctor can cure patient. So empathy is very important.
Yeah. So, do you have any idea about the difference of sympathy and empathy?
No, I need to work. No, I'm not really sure.
Okay.
Empathy
Mm,
is for others. Sympathy, I actually.
no problem. No problem. Go ahead. You are doing really fine. That's not a problem. Okay. So, you said that you participated in some dance competition, right?
Yes.
So, in India, in which class? I really like dancing. That's why I'm asking.
Oh, wonderful. So like I mentioned, I discovered myself when I went to medical school. So when I was in high school, until high school, I was the person in my family who used to be stiff. I never used to move much. But yeah, when I entered medical school and I got this opportunity to dance on contemporary dance and hip hop, I started practicing, and my family was very much shocked and surprised when they saw me dancing on stage. So yes, I do contemporary and hip hop, and I've participated in multiple dance competition, in group dance competition. I want to emphasize that, and we won as a couple of times as a group.
Good, very good. So, what do you think? If you were not a doctor, you would be a dancer?
No, I'm not that good at it. But firstly, to me, I don't think anything else makes sense like how medicine does. Uh, but if at all I have to choose a profession, I would love to be a runway model because I follow some of these models, and they are so confident, beautiful young women who have so much of following, and these are the trendsetter because they have this audience, they have the platform to speak, and you can make a big difference in the society just by speaking. So yes, I would love to be a runway model, if not a doctor.
Okay, that's great. That's great. So, what do you think? What is your biggest weakness?
Uh, sure. So a few years ago, when I was in high school, I struggled with being overly self-conscious and hesitant in talking to people, and yeah, I tended to keep to myself, and because of that, many of my classmates didn't know me well. And once I started applying for medical admissions, I knew I had to move out of the zone uh, and interact with people to gather information. So since I come from a family of non-doctors, I had to network extensively. This whole experience made me more extrovert and more comfortable in talking to people. And when I entered medical school, I worked on this skill every day, and I participated in multiple activities, which made me more confident and self-assured as a person, which I lacked in the past. I will not claim that I'm 100% confident in speaking to a larger audience. This is something which I still have to work on. But right now, I can say I've come a long way. I was the quietest person in the family, but now when we go to church or any social gathering, I'm the one stepping out and talking to people. So
That's
yes,
pretty
this
good.
is
Yeah. Yeah. So, as a doctor, it's our part of job to communicate with people. Like we have to
yes.
do lots of communication. So, have you ever got any feedback on your communication?
Yeah, I would like to actually share a story which happened recently this year when I was working in nephrology department in Delhi. I
Mhm.
love teaching maybe medical students or patient education. So whenever a patient comes to me, I make sure that, because I was working in nephrology, I make sure that the patient and the relatives understand what CKD is and what dialysis is, so that they can make an informed decision. So when I was leaving my department to come to the US, I just told one of my patients that won't be here next week, because this patient has been seeing me since so many months, because they come every third day. So she also knew me very well. So I just told her I won't be here, and she lifted her sleeves and she said, "I got goosebumps. Who will I talk to once you go?" So yeah, that was the time I realized that patients does value me as a doctor, and they come. She said, "We always come to you instead of going to a senior doctor, because you make it sound like you explain everything so nice." So yeah, that was the incident when I realized that yes, patient does value my teaching skills.
Yeah, that's really important. Like when I was a young doctor, I really valued patients' feedback. That's really important. Yeah, and when the patient gives us the feedback that you were good, you did a good communication, that's really matters a lot for us, right? Yeah. So, have you ever got any criticism from your mentor or your attending? How did you deal it? Can you tell me a scenario?
Sure. So this happened. What I remember right now. So this happened when I was in medical school. I was in my third year of medical school. This was my surgery posting, and I was working up a patient with carotid body mass, and I was still learning how to take history and how to present. And I worked up this patient, and I presented to a big team, which included two attendings, the head of department, and my medical school batchmates. So it was a team of 20 students, people to whom I was presenting. And I remember presenting, instead of saying catted, the mass has increased warmth, I said mass is warm. So the head of the department of surgery that time, vascular surgery, he scolded me that, and that time I felt little embarrassed because I was getting scolded in front of so many people. But yeah, when I look back, because of that incident, I have improved so much on presenting, and now I know when to say increased warmth and use each and every word properly. So thanks to that doctor who scolded me. And so yes, it was a criticism, but I took it in a positive way, and I've improved a lot.
Yeah, that's good. That's yeah. Criticism helps to self-improve, right?
Yes.
Okay. So, what do you think? What will you bring in our program?
uh, sure. So I think my work experience and my medical education has given me some unique qualities, uh,
Mhm.
which I would like to share when I come to your program. So today, I know when to advocate for the patient, when to ask for help. Today, I understand what's the importance of being calm and respected uh, in chaotic situations, when things are not going all right. So yeah, these are the qualities which I have learned from my experience, and I would like to bring it to your program.
Okay, that's good. It was very nice to meet you. Thank you, Dr. Jacob. I hope to see you soon again.
Thank you.
Thank you. Yeah, yours was good. Maybe I asked you some tough question, right?
Mm, I don't know, because I kind of knew answers of all these. I've thought of these answers like earlier, so it
So
was not.
the
I didn't really realize at any point that, oh shit, I don't know about this. So I want to have that during mock sessions.
Yeah,
Sympathy,
because
The one.
I don't know. Yeah.
I'm done with some interview. Like I did 3 interview already, and I found that the 50% question will be you are not prepared for that.
I also
So
gave my interview day before yesterday, my first one. I was very anxious, but it went well. Mostly they were asking me to ask questions. So yeah,
like you were prepared for most of the question in your
yeah,
interview.
I could answer all the questions. It was not something which we prepared. It was very gentle. That describe your day when you were working in Delhi. So I
Yeah,
described
yeah, yeah. That's how like yeah, I found that like at least 50 to 60% question were common. This the your weakness, your conflict,
yeah.
this type of question. But about 30 to 40 or 50% question was uncommon. 2 days before I had interview, and they asked me the difference between sympathy and empathy.
Okay. Yeah. Thank you for the question. I'll work. I actually
Yeah.
check out definitions and work on it. I
So
know, but I can't explain it.
yeah, so just explain it. How do you know that? That's the thing. Yeah. If
Mm.
you are like you have little bit of idea about it and you think that you know it, you understand it in your heart, then just say it what you understand. But if you are not like sure, or if you think that you have no idea about this, then you can ignore it and say that I'm sorry, I don't know about it. Yeah,
Okay.
it's always better to say no, I don't know it, than confidently giving a wrong answer, right?
Yes.
So that's so they asked me and I answered it like that, like sympathy is something that you are in pain, and I know that you are in pain, I'm feeling sorry for you. And empathy is something that you are in pain, I'm feeling it in myself, that how much terrible you are, maybe you are feeling. So I will try to treat you appropriately, like I'm feeling it in my own body, something like that. And yeah, I looked for it in the ChatGPT what it actually means. And that's the thing, like empathy is something that we are understanding it, like we are feeling it.
Yeah.
I think we're good. Like I know that I asked you some question that you should not be prepared, and yeah, so it was good.
Was I also fast because again I get feedback that I talk fast and
But I think it's kind of normal when I'm nervous. We speak a little bit fast.
okay, it seemed like sounded like I was nervous.
No, no, no. But in our heart, we are nervous, right? When I'm doing an interview, we know that we are nervous.
Yes. Okay.
So, what the other feedback? There's 14 other participants.
Oh, anyone wants to give feedback on anything?
Divya. I think you sounded very confident. If that, like, even if you spoke fast, I think some people, it's a 50-50 chance that some people think that it's just your nature. So I thought that it was just your nature that you speak fast, but it didn't seem nervous to me anywhere. It like you delivered your answers very confidently.
Okay, but do I need to work on speaking slow?
Maybe a little bit because you never know how the other person would perceive it.
Hmm.
So maybe
Yeah.
a little bit, but in terms of confidence versus nervousness, I feel like you were confident.
Okay, thank you.
Yeah.
Back if you want to.
Yes, please.
Yeah. So my concern is I just joined today, so I listened to you. Everything is perfect. The only concern is change your tone according to the person. Like if you have, of course, these are video and virtual interviews. So if you see the person who is basically accepting your tone, just
Hmm.
continue that. But if a person is little bit different, like he can basically be, or he or she can be like a little bit upset, then just slow down and change your tone. You know what
All
I'm
right.
saying?
Yeah, kind of.
That's the only feedback. Yeah.
Okay, thank you.
Yeah, and one thing maybe I would like to say that it depends on the age of the person. If the person is really like above 65, 70, they may have some hearing issues. So sometimes
Okay.
we should speak loudly, because I heard about a PD. He's above 70, and his resident said that when you will be interviewing, try to speak a little louder, because sometimes he doesn't hear what we are saying. So
Okay.
that's, yeah. And I felt like mm, we should be like more professional when we will be interviewing with Deshi PD from anywhere, like India and Pakistan, Bangladesh, and anywhere. Like they want us to be more professional.
Yeah. We cannot be American or
Yeah,
use
yeah,
casual
yeah,
languages.
yeah. So when we are interviewing with like a white PD, they're more friendly, but our Deshi PD wants us to be more,
Yeah,
yeah,
correct.
more professional. Yes, because they really want us to take that. They really so they start the interview with positivity. That's like that's true that they really want us to take. So they expect more.
Hmm.
Sorry, do you mind if I just ask a question? I'm actually having my first interview in a couple of weeks. Um, from what I've been hearing, a lot of these interviews are in fact quite friendly. So I think the fact that we are over preparing is generally quite good. And I think Abira, I think you mentioned that as well. You said a lot of the questions, well, half the questions are ones that we definitely prepared for, but the other half, they're generally not trying to trick you or make you feel like, medical school entrance interviews I felt were more intimidating, and they're trying to trap you or corner you or be intimidating to see how you react. But with these interviews, is it generally sort of more friendly from your guys' experience who have already had them?
Yeah, to me, it looked very like it was just a normal conversation we were having. I was very
Yeah.
anxious when I entered the room. But yeah, when we started, was the interviewer was speaking more than me. So they were
All right.
the
Okay.
for me it started like for my first interview was taken by a chief resident. So he was mentioning that I was here 3 years ago, and for me it was slightly different because we used to come in person and visit
Right.
the hospital. So how is it for you? How does virtual interview affects you? So yeah,
All
it
right.
was like
Very
conversation.
conversational. Got it.
Yes.
Yeah.
Yeah, and
Yeah.
if we like
And
memorize things, that would make us uncomfortable in the interview, I think. Like some people really write the answer and then they practice is so much that when they deliver the speech, it seems like they have memorized it. And I think these,
yes. Yes.
yeah, that will make us uncomfortable in the interview, because they expect the usual conversation. So yeah, I think
Yeah, I mean, to be fair, certain questions, like for example, tell me about yourself. I'll be honest, I've kind of not yet, but I think I'll eventually memorize it because I keep repeating it over and over. But I think it's almost like a show, right? Like you repeat it so much that you're putting on an act, not an act, but you're basically saying the same thing, but it sounds very unscripted, right? Does that make sense? I don't know, because I think certain questions, you're definitely going to get, and it's hard not to keep going over and over, in your practice sessions, the same thing, So I don't know. It very much feels to me like we're working off a script, but trying to put on a bit of a show, if that makes sense. Like
Yeah.
smiling and all that sort of stuff feels a bit like you're acting in a way, but not acting. But you know what I mean?
yeah. So
I think that's sorry. Yeah, Dr. Abia, go on.
okay, no, you can tell.
Yeah, I was just Dr. BP. Yeah, so it will happen for everyone because eventually you'll be giving multiple interviews and you will, no matter what happens, it will be a afterward,
Yeah,
especially the tell me about yourself question because you will be reciting it multiple times. So I think the feedback which I got earlier was just take breaks. It should look like that, you're just speaking spontaneously and not something scripted.
got it, got it. So have pauses in your response, basically, and space things
Yeah.
out without being monotone all the way from A to Z, sort of.
Hmm.
Okay, no, that makes sense. Thanks.
But
Yeah,
we should know the content. Like when they will be asking us, "What is your strength?" I should be prepared that what I will say, what is my strength. When they will ask me what we should
sure,
do, yeah, that's. But the
sure.
sentences should be in my natural tone, in my natural language.
Sure, sure. And another thing I notice is to be aware of, like, for example, what are your strengths, right? They could ask that, but Abira, you asked a really good question. You said, what can you bring to our program, right? And that's
Yeah.
where you sort of have to go. I mean, you have your scripted, what are my strengths, but just sort of have that flexibility in your responses to draw on what you've already prepared and be able to adapt it towards their questions, right? Because that's pretty much what are your strengths, right? That question is disguised that way, I suppose. So. But yeah, no, it's good. That's I guess that's what I'm just trying to get at. Whether to memorize things, I guess to a certain extent, yes, but also learn how to be a bit flexible. If that makes sense. Sorry, was there a background noise? I'm in a really noisy place.
Not that
That's fine.
much. Yeah.
Okay, great. All right, that's fine. But yeah, no, but I just wanted to add also, Arika, I thought you sounded very natural as well. I know you said you were worried whether it sounded. Did you say scripted or too fast? But I thought it was okay. I thought it was quite all right actually. It sounded quite genuine. Yeah.
All right, thank you. Might tell me
Yeah.
about yourself because I've been saying this multiple times. Did
Yeah,
it
yeah.
sound like was it natural or did it look like
No,
scripted?
that's my point. That's my point. So it didn't sound scripted, and I'll be honest. I've been to one of these sessions before. Well, yesterday was my first day on it, and I don't know who it was, and regardless, it was somebody who was practicing. You know, it was their first time, right? And it was quite monotone from beginning to end, right? So it's one of the feedbacks I gave to try and get away from being monotone. But I didn't hear that at all, and I think that's what that's definitely what helped make it sound not scripted, right? But yeah,
Sure, thank you so much.
yeah.
Anyone
Yeah.
wants to go ahead with mock interview?
I'm sorry. Do you mind if I just ask another question? This is just my second day here, but it looks like I've been, part of this WhatsApp group for some time, but I've had it on mute. So do you all meet here at a certain time, and what is that time, just so I can write it down and try and join you regularly? Is it
This time actually, every day we
is
meet
it
at and what
So I'm in the UK. So right now
UK?
it's 4:30. It's 4:30 here. It's 4:20 here right now. So
It started 1 hour ago. It started almost
sorry,
50 minutes. This session started almost 50 minutes ago. So yeah, I
50.
think
Yeah,
3:30 for you.
3:30. Okay, got it.
3:30.
Yeah. All right, 3:40. Got it. Perfect. Thank you.
I think Dr. BP seems like you like this. You want to join again?
Sorry.
Yeah, it seems like you like the session and you want to join again. That's why you're asking for the time. That's nice.
Oh, that's exactly. No, that's exactly it. Yeah. So I'm actually free this whole week, and I definitely do need to practice because for sure, like I tried to wing it the other day, and it sounded so bad. Like I tried to go in without any preparation, and I realized how much preparation we do in fact need. So for sure, I'll be here this whole week at this time. So just want to make the most of it, and to give feedback and everything, right? So.
Okay. That's nice.
Yeah.
So do you want
and
to
how long?
give a
Yeah.
mock now?
Honestly, it's going to be as bad as it was yesterday because I still haven't prepared, and it wouldn't be fair because it'll be a lot of I'll have a lot of questions, so I'll prepare a little bit more if that's all right, and maybe Tuesday or Wednesday, I'll give it a shot if that's all right.
Okay.
I'm ready for an interview if anyone wants to interview
Oh, there you go.
me.
Sure.
You want to give interview, Dr. Amina?
Yeah.
Yeah. I can take if anyone is not taking. I mean, I like it.
I'm applying into pediatrics. Yeah, sure. Dr. Erica, you can go ahead if you
All
want
right.
to.
Sure. Anyone else wants to conduct mock interview? Because I've already done one.
I
all
mean,
right.
you can start and someone else can ask more questions if they want to. I guess it can go like that if it's okay.
Oh yeah, sounds good. Yes. So hi, Dr. Amina. How are you doing?
Hello, Dr. Erika. I'm doing great. How are you?
I'm doing perfectly fine. So, okay, tell me about yourself.
First of all, I want to thank you so much for giving me this opportunity to be here. I'm really glad to be a part of this interview. My name is Amina, and I am a first generation doctor of my family. I was born and raised in Bahrain, where I finished my schooling, and I moved to India to pursue my medical education. I got admission to the medical school with full scholarship, thankfully. And in the intern year, which were the COVID times, I also worked as a frontline healthcare worker. Since I'm in United States, I had a great experience working in both inpatient as well as in clinical settings. I'm also involved in a community clinic wherein I deliver first-hand patient care. A little about myself. I like cooking. It's really therapeutic to me. And whenever I go outdoors, I like riding a bike. And I also like talking to my mother every day. She's a great friend of mine. Yeah, that's me.
Okay, sure. So why do you want to come to the US?
So, United States was into my mind during my medical school. My mentor, he was a pediatrician, and he was a resident of United States. The way he conducted himself with the patient, with the parents as well, was a very great learning experience for me. And I mean, like, there was something in him which set him apart from others. So looking at that, I wanted to pursue residency in United States just like him.
Sure. So you mentioned that you've done internship in India and then you've had some clinical experience in the US also. Can you tell me a few differences between India and US healthcare from your experience?
Certainly. Yes. So there are many differences between the Indian healthcare system and the United States healthcare system. And I should say that both are acting to the best of their capacities. But the major differences which I found was the primary care system in United States is very strong when compared to India. We do not have the concept of family doctors back there in India. So this was one of the major differences I found. In India, people directly go to the specialist rather than first going to a primary care physician. The other difference which I found between the Indian and the US healthcare system was the patient interaction. Patients in United States, they tend to ask more about their treatment. They are concerned about what disease it is and how, what is the drugs they use, what is the mechanism of action, what is the drug doing to their body. When compared to India, usually patients are not much involved in the treatment. They do not ask much questions. That leads to medication non-adherence because they do not understand the reason behind taking the medication. And the third difference, I believe, is that US healthcare system is very expensive when compared to the Indian healthcare system. So I believe
And
like these are the.
sure. What is your future plan in 10 years future plan?
Of course. So, first of all, I am dreaming of getting graduated from your residency program, hopefully, and I will be applying into the fellowship into neonatology. So, basically, being a resourceful neonatologist and working to the best of my ability. And the next thing is because I believe like simplicity is the key to my life, a small, beautiful house and a beautiful family, raising my kids to be responsible citizens of the world. So I believe like this is what I'm seeing myself after 10 years.
Okay, that's wonderful to know. You mentioned you want to do fellowship in neonatology. Why did you decide that? How did you decide that?
Yes, of course. So this again happened during my medical school, wherein I was posted into the NICU department, and I would see these small, tiny babies who were like 28 weekers, 29 weekers, and I felt like it was like a miracle, a magical thing happening by such advancements in the science technology. How such, and we even had these babies graduating, so we used to conduct these small graduation ceremonies for the babies who used to move out of the NICU. So, and I would see that how much of a difference can a small 28 or a 29 weeker cause? He would go up to a 30 weeker or 32 weeker and he would get graduated. So it was very magical for me to see such small babies grow up. And they my attending himself was a 28 weeker, and he would explain this to the parents, saying that I myself am a 28 weeker and see what I am doing today. So you don't have to worry about it. Even small babies can grow up tomorrow and be the future of this nation. So I want to be contributing to that.
Okay, so what do you do outside medicine?
Sorry.
What do you do outside medicine? You spoke so much about your career, your work experiences. What about work life outside work? How is it for you?
So most of the time, like whatever time I have left, I always spend it with my family and my friends. This is a kind of stress reliever for me, I should say. And I also invest a lot of my time in cooking. Whenever I have time, I try to cook good food and host good parties. So I'm usually most of the cooking and hosting parties kind of person, and indirectly spending more time with my friends and family.
Okay, so do you have family in the US?
Yes, I have my family in United States.
All right. Um, you mentioned that you love cooking. What cuisine do you cook?
So I'm from Hyderabad, which is in India, and Hyderabad is known for its good food. So I'm mostly into the Deccan cuisine, I should say. So I cook great biryani. I believe this is really personal to me because it was a recipe of my grandmother, which was taught to me first-handedly by her. And I have been practicing over time, and I feel like I'm good at cooking biryani.
That's wonderful to know. I would like to try your biryani sometime. Uh,
Surely.
all right. So what, according to you, professionalism is?
That's a really interesting question. So, what I believe professionalism is, what I am is my personality. It should be in such a way that I am organized, I am systematic, I am respectful to my colleagues, and yeah, I think so. This is what professionalism is.
Okay. So we are training doctors to be healthcare leaders, and I would like to know from your past experience, have you had any leadership quality experience in the past?
Yes, of course. So I had a great leadership qualities in my past. I would like to give an example of a very recent one. So on September 30th of this year, we had a Day of Dignity event in Philadelphia, wherein I was one of the members of the organization. I mean, I was one of the members of the organization. So we had these many beneficiaries, almost like 150 beneficiaries, who we supplied all the essential. All the essential products like the hygiene kits. We gave them free flu shots. We had small stations for health promotion. We had small stations for a random blood sugar level check. So it was a very successful event, and I was mostly on the leader. I was mostly organizing the health sided. That was my part. The health promotion was on my part. So it was a very successful event, and I think so I did a great job that day.
Yeah, good to know. So just tell me a incident when you had a misunderstanding with your colleague.
Yes, of course. So there was this. So during our intern years, we had to write progress notes. We specifically used to write these progress notes regarding each and every patient. But there was one of my colleague. Whenever I was like post call or when I was when I was on a off, so my colleague he was not writing his progress notes, and there was a day when my professor came in and he checked the progress notes and he had seen that there were many days missing. So it was quite stressful because he was not so very happy with me, and I had to bear a little of heat from him, I should say. So I went to my colleague and I spoke to him about it, and I told him that this is not acceptable. He has to jot down his notes, and I was trying to understand why he couldn't do it. So basically, he apologized, and yeah. I think so. He understood what the problem was and he apologized, and he was being systematic from the next day and he started writing the progress notes.
Okay. Anyone else wants to ask any questions?
Yeah, do you mind if I just ask a quick question? Amina, could you tell us about a mistake that you've made, and what you might have learned from it?
Yes, of course. So, a mistake that I made. Do you mean in my medical career?
Yeah,
Okay,
yeah, medical career or anything else.
Oh, okay. So, I remember this was happening during my medical school, wherein so there was a patient who came in. He was 68 years old, I should say, and he was diagnosed with chronic kidney disease, and he was on dialysis. He came in to the emergency department with acute diarrhea. So I immediately went in. He was quite dizzy, and I believe that he was hypotensive. So I immediately picked up the BP apparatus to check his blood pressure. But the biggest mistake what I did was I did not ask him where is his fistula situated, in which arm is his fistula situated. So I went in, I put in the BP cuff, but immediately my faculty he came in asking me, "Did you ask him where is his fistula situated?" Um, and I just got concerned about it. Yes, that I did not ask him, because if I would have checked his blood pressure, and if there was on the arm which where the fistula was situated, it would disrupt his fistula. It would cause a clot formation. Or the fistula might stop working after that. So I did not do it. I was going to do it, and my faculty came in and stopped me. And I still remember it till today. I learned something from it. It was a mistake I was going to commit. Almost I should say it was a near miss event. So yeah, I learned from it, and I still remember it till today. I am very sure about asking people who are on dialysis, like, where is your fistula situated?
All right, thank you. Yeah.
Anyone else? I don't have any other questions for you. Uh,
Yeah, can I ask a question?
Yeah, sure.
Yeah. So, Dr. Amina, you said that you want to do fellowship in neonatology, right?
Yes.
So, in neonatology, sometimes the little kids passed away. Do you know, or have you ever delivered bad news to the parents? How do you deliver it?
Yes, of course. So, I did not deliver it first-handedly, but I have witnessed events where in my faculty and the residents, I was a part of the team, and I was just like, I was a part of it, but I haven't delivered it first-handedly. So basically, we used to take the parents in a private room, making it very comfortable for them, and we would deliver the bad news, saying that we are very sorry to inform you that this has happened. We would even ask them, we would even tell them the reason why it happened and all the consequences which led to the death of the baby. And we would be really we would empathize with it. We would reflect to the parents feelings, and we completely understand what the parents are feeling. So this is how the conversation would go, but I never did it first identity, but I was able to witness many of such events.
Okay. So, do you think you will feel comfortable doing it fast-handedly?
Sorry.
Do you think you will feel comfortable delivering this type of bad news first-handedly or all by yourself?
I believe that experience can bring that into me. Like right now, because I haven't done it before, I don't think so. Right now, I would do it. But of course, if I've been given chances in the residency, and if I speak about it to the patients, or in the fellowship, most probably, if I speak to it, and I guess experience will bring that. I'll cultivate that into me after experience, I believe.
Yeah. Okay.
I mean, can I just ask you another behavioral question? Um,
Yes.
yeah, let's say you're seeing a patient. You're into peds, right? You're applying for peds.
Yes.
Yeah. So let's say you're seeing a patient, and the patient needs a certain treatment, this or that, or diagnostic procedure or something. But the parents, they have opposing views. How would you deal with that situation?
So I would see that what kind of treatment and what kind of situation is it? Is it an emergency situation or a non-emergency situation? If it's a non-emergency situation, then I would sit and I would talk to them. I would try to make them understand what the treatment is, and I would like to ask them the rationale behind it, like what is the reason behind they don't want to do it. Like for example, it could be a vaccine. There are many parents who have the vaccine hesitancy, or they usually decline getting their children vaccinated. So I would be open minded. I would try to explain them. I would try to build trust. I would let a trust build up between both of us, between the patient and the physician. And then I would try to ask them the question behind what is it? Why are you not interested in? What is the reason for the mistrust? Either it is a cultural significance, or either it is some bad experience they had before. And even if they do not agree to that, then I would document it that they are not agreeing to the particular treatment. But if it's an emergency situation, then I would preferably go with the procedure, rather than going for a consent, I think so.
Yeah, yeah, that's really good. Do you mind if I just add something to that, or would you rather just have more questions? I just
um
want to give a
yeah.
critique, or would you? Yeah. So basically, the one thing I'll say is that I think the answer was very good actually. But I would open with these kind of behavioral things is just sort of try and gather more information first from the parents to see where they're coming from, right? Because there may be miscommunication, so there may be something simple that you could resolve right away. So I feel like I mean, to be honest, I'm quite used to sort of like just you see the patient, you tell them what's going on, and that's it, right? But lately I've been coming across a lot of behavioral questions where the first instance, just try and gather much information from the parents um, uh, first, right? Does that make sense? I don't know if
Yeah, of course.
yeah,
So basically, I
yeah,
will be asking them the reason behind why are they having this conflict, or why is one agreeing to it and one disagreeing to it. So I will try to understand the reason.
right.
That's what you're right about it. So
Oh, sorry, you
basically,
did
I
mention
will.
that. I'm sorry. I think you mentioned that. I'm sorry. Yeah, you did mention that actually.
Yeah, I mean, like,
Yeah,
yeah, I can take it into consideration. Like, I would be
yeah,
more into like asking them the reason behind their disagreement, or their reason behind. So I just took an example, which I was very I mean, like, I have been in such a vaccine hesitancy before, so I took that example without
sure.
asking you what the diagnosis or what the treatment was. So I just like brought
Yeah,
in one
you
example
could
of my.
you could even say that actually. You could even tell the interviewer, "Oh, I had this situation, and it was yeah,
Yeah.
patient regarding a vaccine and yeah, misunderstanding or whatever it was."
Oh, that's right. Thank you so much.
Yeah, yeah, yeah.
Can I ask one more question?
Yeah, sure.
So why should we choose you?
Of course. So I have heard a lot about more than 1,600, 1,700 applying this year. And of course, all of them are competent enough. But I believe that I am the most deserving candidate, and I'm a best fit for this program, of course, because of the strengths of mine. I believe that I am very adaptable. I have worked in different environments before. I was in India, and India is known for its diversity. So I have adapted to the. I was in Bahrain before, and I moved to India, as I spoke about this earlier. So it was a very new culture to me, new food, new language to me, and I have adapted before. And coming to United States again, I have seen the same diversity as I've seen in India, and because I worked in such settings before, I think so I would bring my adaptability. And the next biggest strength I would say of mine is I take criticism positively, because I believe that criticism is nothing but a way of improving myself, a way of learning, which I'm very eager to do. And the third thing, which I believe, is me being a strong team player. I understand how the team dynamics work. And yeah, and I've also worked in such settings before. So I believe that I'm a great team player, and I will bring my strengths to the program. And the other thing I would like to add in is that I am very peaceful, I'm very calm, and I can bring peace of mind to this program for sure.
Sure, thank you so much. Anyone else with other questions?
I have one quick question.
Yeah, please, can you ask me?
Yeah. So you're an IMG. Do you think you'll face any difficulties as an IMG compared to the US students?
So the biggest difficulty as an IMG coming to United States, I would believe, is speaking in Spanish, because I have many. When I was doing my clinical rotations here, I had seen that there are many Spanish-speaking patients, and I do not understand. Neither do I speak Spanish. So I believe that as an IMG, this will be my greatest difficulty. But your program has great translator services, which will be a very big benefit to me, I believe.
Great. So yeah, that's it from me. If anybody else wants to go ahead, yeah.
Anyone else?
All right. If not a doctor, what other thing you would like to do? Other profession?
So I was always dreaming to be a doctor since childhood, and but it would be a very difficult decision for me if not a doctor. But still, I believe that for a child to raise, to raise a child. There are many commodities and there are many attributes required, like in terms of health, in terms of education, in terms of social well-being. So I would like to contribute in raising a child. So if not a doctor, I would be a teacher, I believe. This way, again, I could help a child grow up and yeah, to be someone responsible. Yeah. So I believe that I would be a teacher. I guess I have to like put this properly. I messed it up, I think.
I have one question for you. Um, if your house was on fire and you were running out, what would be the three things you would grab?
Okay, that is a very interesting question. So, first would be my family. I would make sure that no one is sleeping, no one is busy doing something. I would grab my entire family out of my home. That would be the first thing. And my closet is very close to my main door, my outside, the main door of mine. So, in my closet, I have my jacket and my wallet. So, I guess that would be very feasible, and I would grab my jacket as well as my wallet and then move out.
That's a really good out of the box question, and it reminds me of another out of the box question. Do you mind if I ask you one more of these types of questions?
Yeah, sure.
Yeah, it's basically something I saw on Reddit, so you may have seen it or not. I'm not sure, but you are given an elephant, and you cannot give the elephant away, and you have to keep it. What do you do with the elephant? Oh, you can't sell it or give it away. You have to keep it. So what do you do with the elephant?
That's a very interesting question. So, what I would do as an elephant, so I would get all the children of my neighborhood and I would give them an elephant ride.
Okay, fair enough. Yeah. Yeah. I saw a really good answer. Somebody said, "I'll put the elephant in a big room in my house. So whenever a guest would come over, we would say, sorry, but first we'll have to address the elephant in the room." Yeah,
Ah,
it's supposed to be funny, but I don't know.
Yeah, that's a good
But
one.
yeah,
yeah,
that's
it was. I thought it was pretty funny. Sorry, I had a more serious question, but I lost it. Let me just scroll here and find it again. Let's see.
Yeah.
I,
While you think of the question,
Yeah.
Amina, tell me a joke. Do you have any jokes you
Oh,
want to
that's a
share?
good one.
yes. So, you want to hear a joke? Okay, so can you please tell me why did the physician, so he had an X-ray of of a hand, X-ray of the arm, okay, and he was
Yeah.
laughing. So why was he laughing while looking at the X-ray of the arm?
Something to do with
Because
the
it was,
humerus.
yeah.
Yes.
That's good.
Oh, she
Yeah.
knew the answer. I wish my program director does not know the answer. That was a bad
So
joke, I think.
yeah, that was good. So you're applying for pediatrics. Could you tell me some of the challenges or that's facing the specialty of pediatrics going forward in the future?
Uh, Okay, yes, that's a very interesting question. So the first, so I have seen, I was reading an article 2 months back wherein they said that the number of pediatricians are decreasing every year in United States, and there might be a time where there would be a shortage of pediatricians. So I believe that this is a very challenging thing, the number of pediatricians decreasing over time. And the second challenge, what I believe, is the vaccine hesitancy, as I spoke about this earlier. So in India, there were cases wherein the patients did not even want to get did not even want their children to get vaccinated, like not even the vitamin K prophylaxis. That was the basic thing immediately after newborn. They didn't even want their children to get that. So I believe that after the COVID times, the vaccine hesitancy have increased. And the third thing is would be the antibiotic resistance. I have seen many. I'm reading another article a few days back, which said about the increased antibiotic resistance. So I believe that these are the three major challenges the pediatrics department will face ahead.
No, thanks. That was
Um,
good. Thank you.
Yeah, one more question. What is one thing that you do not like about pediatrics and you want to change?
Okay, that is a very interesting question. So, during my medical school, whenever the babies, we used to draw, I mean, like not me, the nurses used to draw blood out of the baby's arms. And I feel like there should have been some other more painless procedure to draw blood from. I mean, like being an adult, I can understand that it's not a lot. It's not very painful. It's just like a prick. But then for babies, I see them cry a lot, and I wish that there was a painless procedure to draw blood.
That's
I
a
do
good
that
answer.
myself.
So I have one more question for you.
Yeah, sure.
What is work-life balance to you?
Uh, yes. So I have heard this from many residents that maintaining a work-life balance is very difficult, and we have to spend a lot of hours in the hospital. So of course. So as I spoke about this earlier, saying that I like to spend a lot of time with my family and my friends. So what I would try to do is for maintaining work-life balance, if I have really stressful hours, I would not think about the quantity of time I'm spending with my friends and my family. I would rather focus on the quality of time I'm spending with my friends and family. So basically, this is how mm, I will I will work on my work-life balance.
That's great.
Um,
What do you
sorry,
think?
go
How
ahead.
is this? I don't know. What do you think? How is this answer?
I think it's good because for everyone, work-life balance is something different. So for you, because you value spending time with your family and friends, I think you can say that, yeah, getting to spend quality time with them is the work-life balance. That is a good answer. Like, I think it's good.
Okay. What do you think? Like, can if you can like put your what would be your answer if it was work-life balance?
Me, I have noted down like a few points, which is if I'm like able to spend time on myself, like get good sleep, at least
Mm-hmm.
like if out of 7 days, if I can get good sleep on 4 of those days, not
That's actually a really good answer.
yeah, and not
That's a
feeling
yeah.
not feeling burnt out, so that I can just report to work, being able to like be eager to work. So that's
Hmm.
I think
to
yeah,
me.
it's about. I think. Well, I'm going to focus more on sort of self care and being able to recharge, do things that will help me perform better in the hospital. And like you said, being with family, a lot of people that helps them recharge. Other people it trains them, right? But fair enough, yes. A lot of people are recharged with being with their family, exercise, yoga, meditation. Um, I think yeah, work life balance trying to achieve that is difficult, but yeah, whatever
As
helps
president,
recharge you, I think.
to achieve the work-life balance, but I feel like not being burnt out and like having at least like an hour to spend on myself, being able to sleep properly on like 3 or 4 of the days in a week, so that I can return to work very eager to work because I want to be able to like enjoy my work as well. So that is work-life
Yeah,
balance.
for me, I would add in the point that I think one important aspect of work-life balance for me would be to be able to connect with my co-residents and spend time with them. So activities outside of the hospital that I can do with my co-residents, so I can have a better connection and friendship with them, which will again, I think, reflect back on my work and also my work-life balance in general. So that I would add that point.
That's a great.
Yeah,
What about this? This might be a little bit kind of the opposite, actually. I don't know if this is a valid thing to say, but for work-life balance, I guess sometimes it's easy to dwell on patients, and it's important to be able to sort of dissociate a little bit
Yeah,
from work,
disconnect from work.
right?
Right.
Yeah, so I think that might actually, it might be a good thing, because sometimes and you can even say that as a weakness, sometimes you bring work home and you dwell a lot on patients, which we do, but sometimes you just have to realize you have to detach yourself a little bit, and spend time with your own friends and family and do things you enjoy, because at the end of the day, you have to be healthy to do your best job, right? So,
Yeah,
yeah,
so you can definitely word it this way that being a resident sometimes can leave you with a very heavy feeling at the end of the day when you have difficult
yeah.
patients. And I would like to disassociate and disconnect from medicine for some time and maybe spend some time with my friends who are outside of medicine or something like that. Yeah.
Definitely. Yeah.
I do have one more question for Dr. Amina. If someone doesn't like you, what would they not like about you?
Ah. So, okay, so that's a very interesting question. So, sometimes I do not talk much. This is what I believe. So, sometimes I just feel like keeping quiet and I don't talk much. So, people might consider it as I am just showing them some kind of attitude, I think so. But it's just that I feel like keeping quiet sometimes. I don't know what am I saying. But this
That's
happens.
a really that's a really tough question. And my first instinct is to say like, oh my God, nobody likes me. I can't imagine. First of all, I would want to know why they don't like me because do you know what I mean? I mean, I don't know if that's a bit of a risk going that way.
So,
But yeah,
yeah, no, what this question is trying to ask is basically, have you looked deep enough in yourself to be able to identify what is something people don't like about you? So you need to have
Oh,
an answer for this. Otherwise, it will be
sure,
perceived as
sure,
if you think you're like the perfect person who has nothing
sure.
wrong with them and everyone would love you. So definitely
Right.
have a weakness. And I think, Amina, yours, the one you're saying about not being very talkative and not opening up to people immediately. So you can use it in the sense that, you're in the start, you're a bit of an introvert and sometimes you're not that verbal and you don't express your feelings that openly. And that can be something that people perceive about you when they first meet you and might not like that.
okay. Thank you
You
so
mind if
much.
I ask just another behavioral question? A consultant asks you to do something which you don't really agree with. Maybe it goes against the standard of care. How do you respond? And what do you do in that situation?
Oh, okay. So I would preferably talk to him, saying that this is what my concern is, and this is what I feel about it, and we would come to some conclusion. I think so. If I don't know.
Yeah, yeah, no, that's exactly it. I think the
Sorry, I
best
missed
thing
the
to do is talk
question
direct.
again.
Sorry.
Sorry, I missed the question. Can you repeat the
Oh, no, no,
question?
that's fine. Yeah, basically, I was just asking, let's say, for example, a consultant asks you to do something that either you don't agree with or that goes against the standard of care. How would you react to that? Like, what would you do if you're ever in that situation? And then Mina said she would just talk to the consultant and And I think that's the thing. That's the right thing to do, right? Just communicate. And I would probably go a step further and by saying that just try and understand from the consultant's point of view why they said this or that. Maybe it's something that you're not aware of. Many times there are things that are done, medications sometimes are prescribed off-label for certain reasons. So maybe it could be a learning point for you too, right? So I think that the main part is communication, talking directly to the consultant instead of trying to go, like via and asking another consultant or your colleague. So direct communication, I think, is the way to go. Unless anybody else has something else to add or any other suggestions.
No, I think that was a good explanation. Definitely just be like, I will directly talk to the consultant about it, try to understand his point of view and why he's asking for such a thing. If it's a specific treatment that I'm unaware of, I'd probably educate myself further on it and use it as a learning opportunity.
That's it, right? Exactly.
Any feedback? My feedback is gone somewhere, so I spoke a lot. And can anyone give me any feedback on how is my communication?
So I think you did very well. Like you were very like paced, like very nicely paced, and then you were very clearly answering your questions. I think for me, I couldn't see like a really big fault, but this is again from an IM point, not feedback saying don't talk about fellowships. But I think in pediatrics it might be different. I'm not aware, but yeah, that is one thing I felt like okay. I didn't know if you could or you couldn't because in IM they always say don't talk about fellowships because it depends on the program. So if they do offer like a very wide range of fellowship opportunities, then probably you can. But they always say never talk about a strong interest in fellowship. So for pediatrics, it could be different. But
Yeah.
otherwise, I think the answers were really good.
Thank you.
And I'm from Hyderabad too, by the way.
Oh, nice to meet you, Disbia.
I only got a few of your answers, so I don't know how the beginning was. But I think you were very calm and phased throughout your answers, so that really counts. Even with all of the behavioral questions you were throwing at you. So I think you were doing a good job. Yeah.
Thank you.
You didn't sound.
You go ahead, Dr. BP.
No. I was just gonna say, you didn't sound nervous at all. I mean, if you were, it didn't show at all. It sounded very calm, very sort of. Your answers were very thought out, right? And yeah, it was really good.
Thank you.
Yeah, I liked your interview as well. We interviewed you for more than 30 minutes and you were, uh, and you gave all the right answers, everything. So yeah, you seem to do very well. So all the best.
Thank you. I wanted to ask about the professionalism when you asked me what is professionalism to you, and I just told that it's about being systematic, it's about being organized, it's about respecting my colleagues, and I just told I don't know. What do you think? What would be the right answer? What does professionalism mean?
There's no right answer. And there's a definition, but you described your characteristics, what traits fit into professionalism for you. That was right. You described how you. It was